So good afternoon, everybody. It's a pleasant day, and after the COVID pandemic, I think it's an occasion which we should commend our colleague here and our friend, my brother here, Mr. Deen Dayal sir, for organizing these types of initiative from the CSR platform. And I've been a regular at his for the last 4 of them. So since the pandemic, the 5th one. Yeah. So it's a great occasion to be here back again at the CSR initiative. So my concept is slightly different, right? What I heard when I was sitting as at office the other day was the green energy part of it. And then I told them, I said, sir, why don't we have something on healthcare? You see, pandemic is all about healthcare, and nothing better than the time period that we saw 2 years back. And more initiative should be given to this field. Because whatever problems we've seen with the pandemic around, it's all because of industrialization. It all is because of our attitude towards moving around unexpectedly without any plan. And for that matter, anything which we are not making the environment friendly, either the products or all our luxuries, all our movements, not looking at the environment, just looking at one go. We want the production, we want enjoyment, we want everything. And the God said back, okay sons, sit back home for 1 year. And we've learned the better way. So my initiative was something, why don't we create a green healthcare environment? And that's when I discussed with them and said, why not? You go ahead and give your views about it. So my view, let's see what we have it here. That's the Hospital of the Institute of the Central Government Ministry of Health and Family Welfare, the Lady Hardinge Medical College that I come from. I head the Department for Oral and Maxillofacial Surgery, and I've been the head there for 20 years now, devising the protocols for starting post-graduation and maxillofacial surgery at my place. And recently we've been blessed by the Ministry of Health as having the National Resource Center for OPMD, that is a pre-cancer, oral potentially malignant disorders. That is, before the cancer stage comes in, we got to diagnose them early. So that was a good initiative that we've taken that now on. So it becomes a moral duty for us to come and disseminate among yourselves. So what is the latest regarding healthcare or regarding aspects of patient management? When we talk about green, why did we say green energy? Why didn't we say blue energy or pink energy or something like that? Pink is more with females or cancer, right? Green is basically because it's antiviral or antibacterial. And all hospitals that you see are basically green environments. Our OTs are green. Our doctors wear dresses. If you've been to an OT or a high density unit or a ICU, it's all about blue and green. Because green is basically considered to be antibacterial, number one, and number two becomes blue. Red and black are not there. So that is natural way of light source environment to cause some antibacterial, antiviral aspects in the environment. So that is there, it's already there. And that is the concept of green energy or fuel, or for the matter, anything that we say green healthcare also. But why climate change do we talk about now? One of the leading journals of Lancet in the medical field, it has said that the biggest global healthcare threat is the 21st century, is going to be the energy or the pollution that we come across here. And that is why green healthcare has come in a major way. And we have got some direct climate change into it. How does it affect you directly? You would say healthcare, fine. It is when I'm sick, I go to a hospital, I go to healthcare. But no, it's all about prevention. If it comes to treatment, that is the last point of healthcare. That is why we always lay stress on that tertiary healthcare should be the last. It should be always the primary healthcare which should be number one. A primary healthcare means preventive. So why preventive? Because if you don't go for green energy or a green concept in healthcare, then what you have spread of diseases, like you had the COVID recently, you had the malarias, you had other form of vector-borne diseases like dengue coming in a major way. So these are one aspect that we see if we don't have a climate proper maintenance or sustainability of climate coming in a major way. And whom does it affect? Does it affect the rich or the poor? I think it affects both of them equally. But yes, to a major way, it affects the marginal part of society or the vulnerable part of society or the underserved part of society in a major way. But yes, the rich cannot be out of it. And we've seen that during the pandemic when we had the money, we could go anywhere, but it was impossible to get that healthcare that was to be given to us. So what is the main driver of this climate change? We all know, is it air pollution that has been happening. And why the air pollution? Because we've always given thrust to industries. We've said we want to produce more. We want to always get a good GDP. That has been our target through in and through day out. From historic time it's been there. Get in more machines. Let's produce it. Let's use the fossil fuels that are there. And now the time has come in when we realize this. And we've seen during the pandemic, we could see the sun. We could see the stars right up in the Delhi sky. And remember the SpO2 levels or the AIQ levels were very high previous to that. And everybody say, don't close down, have it odd and even. And suddenly you had seen the lockdown happening for 3 months and your skies cleared out totally. So that is the beauty about that managing air pollution. And if you want to manage this fossil pollution around or decrease the fossil combustion around, we have to go into green, could be green concept of energy and including green healthcare. Because why? Because compared to these problems that we are seeing because of this air pollution, you see more than 6 million people are dying because of these pollution related issues, whether it be cancer, whether it be COPD, than people are dying whether due to HIV, AIDS or malaria or TB or all of them combined together. If you see all the diseases, people are still dying 6 times more because of this pollution level or not following the green concepts in healthcare. So how does healthcare contribute to carbon emissions? Through energy consumption there. So once we talk about green healthcare, we say, well, fine, you reduce your output, you reduce your toxic chemicals. It is not on that. You see, when a patient comes to me, he comes by some transport, isn't it? He's got to burn that fuel in his vehicle. And if he's going to produce that air pollution, automatically we can't have a green healthcare. So we need to be accessible always. You see, healthcare has to be accessible. It has to be affordable. These are the 2 primary objectives for providing any healthcare to any person. If you're not accessible, that's a problem in healthcare services that are there. Can we have the slide please, back again? Yeah. So similarly, when now this is regarding the transport part of it, whether it be the doctors coming to the hospital, the staff coming to the hospital, the patients coming to the hospital, everybody is going to use some sort of a vehicle for transport. And if we are not energy compliant, I think we are going to pollute our environment. The second aspect that relies is basically on now on is the energy that hospitals use. You see, hospitals are big industries where you have OPD running, we got lab running, you got investigation X-rays running, you got an Indo facility, you got OTs running, you got HDUs running, you got a kitchen environment, you got CSDs. It's a multi-complex, a small city in it itself they're running in a hospital. So the energy requirement is quite huge. And if you're not going to target this energy in a green environment or a green type of aspect to health energy, we are going to cause pollution again. So that is one major aspect that we need to take in. And we've shown here, why not use the solar energy in a major way in providing health care in that hospital? Why not? We can do that. And India could be a global roadmap. And our Prime Minister has shown it. Mr. Mittal was saying about it. The PM has set a target of 2070 that we would be zero carbon dioxide emission. So that is a major way to do that. Why not be green command from day one itself? It will not be 2070 we go zero. It has to reduce itself over a period of next 30 to 40 years down the line. So green concept is one that aims to the environment being friendly, utilizes the renewable resources of energy, reduces the waste. That's more important. You can't have zero waste because you're going to treat people around. The hospital is going to treat. But yes, you can reduce that waste in a major way by implementing green practices and enhance. You have to, because unless you provide patient care services, you can't be a hospital, you can't be a healthcare institution. Or what is the use of being there? So you have to provide that well-being to this patient who visits you. And the concept of a green healthcare works on 3 things. That is the 3 R's of reduce, reuse and recycle. And hospitals or healthcare institutions can come in a major way to do that for the world. So there's some pathways or processes to this which can be done. if you see, there's some direct, there's some indirect to it also. To provide a sustainable environment, to provide resiliency to these energy fields, and ultimately a sustainable environment for the second generation or a future generation in the times to come. The global warming, if you see, until 2019 was there, and the pandemic came in, and it's all down now, much lesser than what it was before 2020. But if we don't take this step now, in the years to come, it will be further bad. From bad to worse, and worse to be all down. If we need to survive, we have to go green, and that is the only answer that we have. Whether we reduce our output from the healthcare institutions, could be needles and syringes. Well, it all came into being when the HIV came in. Before that, we were used to use all disposable needles. Yes, we used to use all sterilizable needles and syringes. No disposable was there. But when the HIV struck and the hepatitis B came in a major way, then the plan came in, we have to use disposable. To create this environment of more plastics, why not? Why can't we have reusable syringes again? We could go back. We're doing studies on this. But yes, the needles have to be disposed of because they're sharper. You cannot sterilize them and use on other beings. Otherwise, you'll be transmitting this infection from one person to another. There are other aspects of healthcare which are used. Radiations, could be CT scans, could be X-rays, or other types of radiation in chemotherapy or radiotherapy. These come in a major way, and they could, each and every system of the body would get affected if we don't reduce them and use our resources judiciously for the betterment of human mankind. Because climate is resilient, and the environment has to be sustainable in the years to come for the healthcare. So it has to be a double effect of using both the resiliency for the climate and causing a sustainable environment for the years to come. And how can they do that? That can be done. You see that picture that I've shown you. It's got some solar panels there. Look at the green grass that is there. The color that gives to your eyes, very pleasing. It suits you there. And this is type of aspect that we want in our healthcare also, in our hospitals, in our dispensaries, in our wellness clinics, and at homes also. If you remember, initially when we had prehistoric times, were there hospitals? There were never hospitals. There used to be religious places where a person used to go and he used to wait for his deathbed to come in. It was only after around 1940s or 50 that the concept of hospitals or tertiary care centers came in, and then we had buildings and tertiary care institutions, all the resources there at one go to save the patient's life in whatever way possible. So that is one aspect we need to take about. It's not about just building your machines at one go and making 5-star hotels or making energy devoid buildings or devoid processes. We need to use all reusable or resources there and provide treatment on betterment for the well-being of the patient as a whole. So if you see this graph that is there, it clearly demonstrates there where you were. If you are a low level of healthcare, it doesn't matter to the environment. But if you have normal level of healthcare or slightly normal than that, if you see that line, and if you do not follow the prevention strategies that are given in the base, then the time comes in, then you really dip. You dip into the lower level that you see the graph in, and that causes the problem. And from there are the processes that you learn. If you have already provided some auditing and learning part into your healthcare aspect, then automatically you will rise above the level and you would provide some healthcare into a better life for the patient as well as for the environment in the times to come. So this is the various aspects of healthcare that could be either by the patients or by the doctors or by the staff in the hospitals, including the other aspects of reducing the waste. Could be your X-ray waste in the matter. You're having machines where you get a film. It's not required. You need to go digital. You need to provide all DICOM files to patients. Why need to print the film down and provide a toxic environment there in that healthcare, ultimately into the society as a whole or the globally also? You need to be digital. If we go digital with all our healthcare investigations, including CTs, MRIs, routine X-rays, just provide a DICOM file to it. I think we have made a day into a healthcare, including a world of better healthcare or a green environment for a future generation. So what does the action lie? All healthcare facilities, services and processes are environmentally sustainable, using safely managed water, sanitation services, and clean energy, which are sustainable, managing their waste and procuring the goods in a sustainable manner, are resilient to extreme weather events and capable of protecting the health, safety, and security of the health workforce. So it has to be both ways. The health force has to be sustainable, it has to be healthy, as well the patients who are there in the society or the community, they have to be healthy also. Otherwise, the hospital or the healthcare institution is not doing justice to the environment. So what are the 4 fundamental requirements for providing safe and a quality healthcare? The first and the foremost is the manpower. The manpower has to be trained properly in managing these resources. Second foremost is the water and sanitation. Why? Because once we reuse that water and the patients who are there, they are suffering from some infectious diseases, that water is, if not recycled, it will go back into that environment where a normal community is living. And this water, when it goes to our rivers, lakes, or to the fields around, we're going to spread diseases. And that is what is happening in a major way, especially in our country, a third world country like India, where you're not treating our waste from our hospitals. It is not being treated in major hospitals. It could be in government hospitals, we are doing that. But maximum the private institutions or in B grade cities or C grade cities, it is not being done. And that is where the problem comes in. So we were at the 4 processes, the fundamental requirements for providing safe and quality care to our patients or to the community as a whole. And we talked about healthcare personnel. We talked about water, where the water has to be treated from the healthcare institution before it is given back to the rivers, lakes and ponds, or to the fields for that matter. Because this contains quite a bit of mercury waste also. From the hospital used to going there. Under the Minamata Convention, when it came in, India became a signatory to it. And we said we would reduce that mercury waste or eliminate from the planet. And we have reduced that or stopped using mercury products in healthcare institutions since the year 2020 now. We have stopped, and we will eliminate that by a few years from now on. So in our healthcare institutions, we are not using any mercury thermometers for that matter. We are not using any mercury BP apparatus as we normally saw your family physician taking a blood pressure. He used to use that mercury. So that is not there. It is not being manufactured. It's not being sold now in government institutions. And a few years in private also it will not be available. Mercury fillings, common things. You go to a dentist and the best filling what he tells you is a black chandi filling. I'll do that chandi filling and you are happy. These days it's banned, it is not done there. Reason again being mercury is the end point of it. And we had no control of it into the environment, into the waste that was going there, into the sewage system that used to going there. So we had to have filters there. So that was the main issue there of using mercury and reducing it. So we've signed that, we've eliminated mercury in a major way from the thing. We were at the framework part where we talked about the 4, the healthcare personal type of thing we talked about the water and sanitation parts, we talked about the reducing the waste outputs when we were discussing about the, whether it be the mercury, that we talked about the convention, the Minamata Convention, where the mercury was banned from the planet around by the UN Convention, and India became a signatory to it, and now you don't find any mercury clinical thermometers, you have all digital thermometers, you've got digital or gaze-based BP apparatuses, you don't have any mercury fillings for that matter, or we call it the chandi fillings by the oral or dental professionals in the country. So it basically boils down to everything is in our hands, and we can change the world and make it a better place. It's all in the hands to make the difference. So it's a question of options, you know. Options were there. You had an option to come to this symposium, listen to the green aspects of the energy and the healthcare, and you took that option. So life is question of options, whether you want to use a green fuel or you want to use a fossil fuel, if the times are providing to it. So everybody would like to contribute in their way, as Prabhuji was saying, into the EV industry or using some type of biofuels which would be more climate friendly there. So this is a local trade that we see on the streets of West Bengal. And what is he selling? Can anyone tell me what's he selling there? It's a tobacco. Okay? And it's was a major source of pollution again, including self, including others. And he sells on the streets like that. You have the e-cigarettes there, which cause lesser pollution, but no pollution, I would not say. Like you have the fossil fuels, you have the CNG. It is a non-polluting vehicle. It's a polluting vehicle, but is less polluting compared to a petrol or a diesel or a kerosene fuel well. What do you have here? It's like a grocery shop that you see here. He's got tobacco and betel nut in various forms. So what is he creating to? He is creating a healthcare environment which is the patient is going to either smoke or he's going to spit out. And no other way better than the COVID times that we've seen. That if you spit out also something, you are spreading diseases. It is not that you don't spread diseases. And this is the problem of our part of the country. The cigarette is not a part of our part of the world. The Southeast Asian region, 80% of the people are non-smokers. They use the smokeless form of tobacco. And majority of these 80% who consume that are between the age of 13 to 15 years. So you've caught them young, and once you get them right into your fold, you are dependent upon the tobacco and you can't leave it. It's a major source of pollution in the country. We started with BDs, cigarettes and all, and how do we are targeting our younger group? By some marketing strategies. Could be in malls, we are giving them hookah bars. And that's a way of life that is everybody's having. It's all a question of pollution there. So health is all about people. You can't be healthy without being at the driving seat there. So what does a patient want? Then what he needs is totally different. He might want, say, doctor, I want some aspect of my X-ray. But he doesn't know it, that if I develop that X-ray in a solution, if I use a printing output, I am going to cause ultimately some sort of environmental pollution there. And if I give a DICOM file, what we were saying, typically a file which is software oriented, I don't require a printout of it, which can be conveyed easily from one person to another, one doctor to another, and the patient can save it. The government of India has taken an initiative by the name of Aadhaar now, where everybody will have a digital card or a number, and all your healthcare records, whether you go to a healthcare provider, whether you go to a hospital, you get a blood test done, an X-ray done, all these will be saved into your number, and that will be used by blockchain technology, where you will have an access, and whenever you approach a doctor, you will have to give your number there, the doctor gives his number, and then he can access your total sheet around. Whatever medicines you will be prescribed will either go back to your phone or your email ID, along with that a copy to your insurance person. So you're covered there without any emissions. You are reducing paper output, ultimately green environment. So that is how healthcare can provide in a major way of green healthcare. And that is what we have shown there. What measures can be taken for a green healthcare. So I talked about mercury elimination. And you know why now? When you go to a dentist, nobody tells you I'll do a black filling or a silver filling for that matter. They'll all do a white colored filling. So the concept becomes very nice, a white filling, which is good for the environment. A green technology comes in. And that's the beauty about it. Biomedical waste management, we've come in a major way. All our biomedical waste products that we generate, whether it be blood soaked, whether it be tubings, whether it be catheters, whether it be needles, whether it be syringes, are to be destroyed and segregated in a perfect way, which is to the Pollution Control Board of India, the PCB that is there, or the Central Pollution Board. And if you do not follow them, then of course the law is there and action is taken. So that is one care again where we can contribute in a major way for a green environment, or for the matter bigger thing, a green healthcare, as I would say. The Lean Six Sigma there coming in a major way, where all your processes, as I said, were to be in a major way where you would reduce the use of technology, reduce the use of any emissions that are happening, or make it shorter and simpler. So do you have a Six Sigma approach to the processes in healthcare also? That's a major area of concern in healthcare. Digitalization, what are we talking about? We talked about the DICOM files of all our X-ray films being sent across, or for the matter, an Aadhaar card being generated. Aadhaar card, that will have the technology. So you don't need a printout of any prescription slip. You can just go to a doctor, tell your number there, and through his computer or through his laptop, or he'll see your healthcare record there. So the focus is all on green concept of healthcare. And imagine you sitting in a room like that with a background of a green environment with trees and green areas. Suddenly you are healed. Internally you are healed. You can recover much faster than seeing a room which is totally blackened out, or dark black totally, or a bluish, or you can't see through just within the four walls. So this concept of healthcare, when you're given a room like that, is certainly better than staying in a four-walled room, blocked off from the environment. Indoor air quality is in a major way, and that we learned from the COVID times. You don't need to be in a closed room. You need to have ventilation in that room. You need to be open. Otherwise, all the planning used to be internally. You should have ACs, everything, 24 other bases. Is that good for healthcare? It is not. For a time period it might be good. For a longer time period it is not. It is not there. Greenhouse keeping. You have green plants inside which will generate oxygen for you. And we've learned from since school days that we should be close to plants in the morning. Not at night when they emit carbon dioxide, but yes, during daytime when they have photosynthesis, be next to them. Get the oxygen directly. They are your oxygen concentrators. And we know about oxygen concentrators last year when oxygen was in less demand. And why did it go in less demand? Because that time all our healthcare institutions were basically not planned properly. We had oxygen, but that was only meant for where? For the OTs, for the ICUs, for the HDUs. In a ward we said no, not all beds should have oxygen. It should be only 20% beds which have oxygen. So you are having basically a 5-star hotel there, no oxygen. And that is what we faced. And now it has become compulsory that each bed in a hospital should have an oxygen supply to it. And that is the demand increases. You have guidelines for landscaping in the hospital. So when the patient is recovering, you take him out for a walk, you take him in the wheelchair, and he sees that green environment. I think we internally feel healthy. It's all about healthcare is not physically, it's mentally, physically, socially, and spiritually also. So all these aspects of healing should come in, and not only a doctor prescribing you medicines. It should be environment also, we should be healthy for you. The clean, green environment we should be given in any healthcare institution for that matter. The outside environment, landscaping I talked about, where when the patient goes, he feels healed internally. So to conclude there, incorporating designs in healthcare could be lighting. You don't need artificial lights. You take in the natural lights in the healthcare. That would reduce your energy source. You have solar panels there. You don't need to use the biofuels there for generating electricity. Using innovative technologies to reduce that energy and water usage. We talked about that. Recycling waste products, we talked about. How can we recycle any waste product there? Could be syringes, we can recycle them. Could be implementing various tools like lean management or Six Sigma approach, or reducing our processes where we use or reuse the things, or reduce the usage of the things, or recycle these products in the processes. As I talked about, lean management or Six Sigma approach in investigations could be your X-rays, your CTs. You don't require a printout of the photograph that is there, give it to you. It could be on your laptop, on your phone. It could be conveyed to your doctor immediately for a consultation. Reducing hazardous chemicals. Now, why use mercury there? It should be out. So similarly, we'll come to fluoride. Now, every toothpaste today, if you go back, every toothpaste that you use has a fluoride component there. And what is fluoride? It's a chemical. Is it good for the body? Nobody knows that. Is it required by the body? Nobody says that. Why? Because it's a micronutrient. We call it a double-edged sword. And that is what fluoride is. And today, all the companies in the toothpaste are putting in fluoride. Not 1 ppm or 10 ppm, 20 ppm, at least 700 to 1000 ppm. And this is going to come back to us. Why? Because our water source, our energy, our soil source is already rich in fluoride. We are endemic in fluoride. The subcontinent India is endemic in fluoride. You've got fluorosis, a disease which is rampant in Rajasthan. You go to Tamil Nadu, you go to Andhra, you go to Haryana, you go to Punjab. Everywhere it is rampant. The reason being our water level source which we taken for consumption is high in fluoride. Everybody says use an RO source. Good. You can reduce the fluoride, but it becomes zero. And that is why a double-edged sword I told you. Because fluoride is required of the body, but 1 ppm to 1.2 ppm and not more than that. If it crosses 5 ppm or 2 ppm, it causes fluorosis. For 1.2 ppm or 1 ppm, it is good. For what? It prevents dental decay. And it is proven. In our part of the world, it is not required. Because I said, we are already using that water which is high in fluoride. We use our food which is high in fluoride. We use black tea for consumption. We use kala namak. You know how much kala namak fluoride is there? 15,000 ppm of fluoride is there in kala namak. And everybody has a chaat, golgappa, sometime or the other. We've consumed the 50,000 ppm directly. It's retained. And the beauty of fluoride is it binds to your tooth and your bones. And it does not release out. So if it is, that's why it is called a double-edged sword. If it is still 1 ppm, it is good for your body. If it crosses 3 ppm, it is bad for your body. And that is what we need to reduce around. The other part, digitalization. We've talked about digitalization in a major way. How healthcare can contribute there. We've talked about implementing green operations, landscaping, keeping our environment green, OT dresses being green. So that is going to be affected in a major way. Our lights, you could take in the natural sources of light. You could use solar energy for that matter. Why use the biofuels for generating electricity there? And conserve the planet or reserve the planet for our next generation. I think if we've done that, we've given a major source to a green concept of healthcare. Because it is all about thinking out of the box. Right? You see that lung there? In pollution, it all becomes blackish. Everybody knows that. Why not to have some flowers there? Red, blue and green flowers growing there. And if you have done that, we've got the concept of green healthcare. But to do that, we have to think out of the box. And normally I show that out of the box thinking by drawing people who've then seen my lecture for 4-5 times would know that I show that square with the 9 dots and you got to connect the 9 dots. You can't do it unless you go out of the box. And that out of the box solution will only be possible if we human beings think differently to derive that problem. The solution will be there. Only thing we have to think out of the box for that solution that is there. These are some activities that we've carried out for that OPMD hub that I talked about, the pre-cancer hub, lecture series being there for OPMDs, doctors taking pledge that we would diagnose lesions of pre-cancer so that we can prevent cancer. Because cancer can be prevented. And how it can be prevented? Just by diagnosing the pre-cancer lesions in the oral cavity, by carrying out breast cancer or cervical cancer examination in females, we can prevent cancer from coming in. Because once the cancer comes in, it's very difficult to prevent that mortality and morbidity. We will have mortality and morbidity to 90%. But if we diagnose at the pre-cancer stage, the mortality and morbidity are reduced to less than 50%. So that is the savings that we want. And that is why the pledge that all the healthcare professionals need to take, including community like your CA professional, the distinguished people of the community that are there. That are other aspects where the department has taken some leadership activities. Could be at the Pragati Maidan that you see there regarding the oral cancer initiative, regarding the children in schools. We've carried out campaigns to make them aware regarding tobacco as a major source. Could be in pollution, could be getting dependent on tobacco, because that is ultimately going to cause cancer in the major way. And a no tobacco initiative. So this all comes back to us as green healthcare when we come down. Because knowledge is of no value unless you put into practice, and we need to do that. All of us who are here now, we've learnt about it, we know it. It's our attitude we should change towards a green environment. And it requires not one person to do that. Mr. Prabhu was saying that. It doesn't require, when it comes back to you, say, you start with it. I know about it, but you start it. It has to be community as a whole. Everybody has to be involved, including doctors, including CAs, all professional fields, including the community people, have to be involved if you want to have a green environment or a green concept, including healthcare, if you want that to happen. And that's again one of the initiatives that we took on the department, where we gave in a social media campaign during the COVID times. It was last year in April, May, when mucormycosis was the major way. And the entry of this virus, the COVID virus or the mucor, which is already there in the oral cavity, the nose, was causing havoc. And we required to clean in the oral cavity. How to clean, that was the main problem. So that's the initiative that we took again. We had the Muh Health Seva. Again, we go down to people and we distribute pamphlets around. That's normally we do. But We've taken that lead there, where we have a telephone number by the number of 1800112032. That's the initiative. Again, a green environment initiative. You can go anytime to this number. Dial up from your mobile phones. 1800, a toll-free number. 11, a daily region number. And why 20 and 32? 20, the set of teeth when a child is there till 5 years. And 32, when he becomes an adult. So that type of concept has to come into each one of us. That why not use digitalization as a major way to do that? With that, I would like to thank the organizers and especially my friend and brother, Mr. Deen Dayalji, for inviting me over here to share my views regarding a green concept of healthcare with you all. Thank you so much. Thank you, sir.